The human heart, a tireless warrior, beats strong and steady, powering our every move. But sometimes even heroes need a helping hand. This human heart, made up of 4 muscular chambers, pumps blood throughout our body. One of its crucial valves is the aortic valve, acting as a doorway between the heart and the main artery. In a healthy heart, this valve opens and closes smoothly, regulating blood flow. But sometimes, due to age and disease, the valve doesn't close tightly enough. This causes a leakage of blood back into the heart. This is called aortic regurgitation. This leaky valve forces the heart to work harder to pump blood forward, creating extra strain. On the other hand, the valve can also become stiff and narrow, restricting blood flow out of the heart. This narrowing is called aortic stenosis. The narrowed valve makes it harder for the heart to eject blood efficiently, leading to similar strain and symptoms as regurgitation. As aortic stenosis worsens, symptoms can arise. Symptoms of severe aortic stenosis: chest pain, shortness of breath, fatigue, fainting, irregular heartbeat, swelling of the ankles and feet. Diagnosing severe aortic stenosis involves various tests: echocardiogram, CT scan, stress test, ECG, blood test, heartbeat monitoring, and clinical examination to determine the severity of aortic stenosis. Traditionally, open heart surgery was the only treatment option. But for high-risk patients who wouldn't tolerate such surgery, hope arrived in the form of TAVR. Transcatheter aortic valve replacement, or TAVR, is a minimally invasive procedure that offers a new lease on life. Imagine replacing the valve without opening the chest. Through a small incision, a thin catheter delivers a folded replacement valve to the heart. Once positioned, the new valve expands, pushing aside the old one and restoring blood flow. This revolutionary procedure offers numerous benefits: shorter hospital stays, faster recovery, and improved quality of life. Don't let aortic stenosis slow you down. With TAVR, the future looks brighter, beating stronger. If you have concerns about your heart health, contact Apollo Hospitals, Kolkata. For any emergency, 1066 can be called if you are within the city limits. For any inquiry or to book an appointment, please call 0334420 2122.